A stroke is an injury to the brain. One type, a hemorrhagic stroke, or intracerebral hemorrhage, is caused by a leaking blood vessel that causes bleeding into the brain. Another type, an ischemic stroke, is caused by blood clots blocking blood vessels in the brain. Atrial fibrillation, or AFib, is an irregular heart rhythm that can cause blood clots to form in the heart. If a clot breaks free, it can travel to the brain and cause an ischemic stroke. AFib patients who have a hemorrhagic stroke are also at high risk of having an ischemic stroke. Nearly all doctors agree AFib patients who have had a hemorrhagic stroke should be treated with some kind of blood thinner to prevent an ischemic stroke. Blood thinners can prevent blood clots, but can also cause bleeding. Apixaban and aspirin are two types of blood thinners. Previous work has demonstrated that apixaban is a stronger blood thinner than aspirin, and it is more effective than aspirin at preventing ischemic strokes in patients with AFib. But since apixaban is a stronger blood thinner and may cause more bleeding, we don't know if it is better than aspirin in someone who has recently had a brain hemorrhage. Prior studies of stroke and AFib did not include patients who had a hemorrhagic stroke. So, doctors do not have enough information to be certain which type of blood thinner is better for these patients. To find out, researchers at more than 130 hospitals throughout the United States are conducting a randomized study. The study is called ASPIRE. It is paid for by the National Institutes of Health. The goal of ASPIRE is to figure out which of these two blood thinners, apixaban or aspirin, is better for people with AFib and hemorrhagic stroke. We are looking for volunteers to participate in the study. Taking part in this study will not affect the rest of your care and will not cost you any money. If you have AFib and have a hemorrhagic stroke, you may be eligible. Participants will be randomly assigned, like flipping a coin, to either take apixaban or aspirin. Random assignment for everyone is the best way to find out which drug works better. You will not know which medicine you are receiving, and neither will your doctors. This is to make sure that you and your doctors won't be influenced by knowing what medicine you are being given. All study medications are provided at no cost. There is no guarantee that you will personally benefit if you join our study, but the knowledge gained from this research will help future patients like you. As part of this study, you will have the benefit of having your study team following you closely and coordinating with your regular doctors. If you are interested in learning more about ASPIRE, please let your doctors know or contact us.